I'll be talking about work-life balance and how to manage private practice, our hobby, and the urban lifestyle. So it's very important that to maintain a balance in life, we have a healthy body, we keep it creative, and of course, we have the name, fame game running through. So, what would we suggest that we all have each of these hobbies so that we can maintain this lifestyle? And how, coming to the first part of it, is it how easy is it to make money? When we very well know that there are different practices which happen in different cultures or countries. And what options I had was a corporate practice, a private practice, an institutional or a government hospital based practice, or a combination of each of these. And this decision is very important. And it's an important decision because it has to be considered taking into view many points, like how much time can I devote to the practice? What are my family commitments? And apart from that, how much and what am I looking for and what are my goals? When we talk about making money, of course, there is a gender disparity in each of the branches, not only medical branch, but even other branches around. And this was a small study done in India, which also spoke about the gender disparity amongst the physician, not the surgeons, although. And this is a data from one of the biggest, one of a very well-known and big institute in India, which talks about that how being a full-timer or attached to one institute may not give you much of monetary benefits, and how running a partial role or having a combination practice is going to help you make much more money as compared to what just being settled in one place would do. Of course, it comes with the cost of extra OPD work, outpatient department working hours. And in that case, how did I manage it? So I currently work at Mumbai, formerly known as Bombay. This is one of the cities very well known in the western part of India and known for its beautiful landscapes and UNESCO heritage. It is also one of the second most densely populated city in the entire world. While it is known for one of the top most richest person in the world, it is also known for the largest slum or the underprivileged society which dwell with us in this city. So how did I manage to go about this city, which was densely populated with all these shortcomings, and how did I manage to ace the practice? So currently I'm working at around 7 hospitals, of which 3 are corporate hospitals, of which 2 are teaching hospitals. I go to 3 private nursing homes, of which 1 is again a teaching place. And it's a privilege to be part of teaching hospitals to impart knowledge to our juniors. Apart from this, I have a clinic of my own and I am attached to a gate lab. And this was not enough in the city of Mumbai that I decided to travel outside Mumbai to serve people around Mumbai. And once a month, I travel to 3 cities around Mumbai, which are in a range of kilometers between 30 to 300. So how did I ace my private practice in the past 10 years? After completing my master's and doing my fellowship programs at different places in India and abroad, I came back and I took one step at a time. I didn't start all the 7 hospitals in one go. It was important to take one step at a time to understand how much I could handle and how much I could deal with. And I added each hospital and each institute one at a time. It is important to plan a travel in a city which is so densely populated and high traffic. So I managed all my practice in a way that I'm not stuck on this side of the road, but rather I'm the lucky one on the opposite side. While the city travels more southbound in the morning and now northbound in the evenings, I chose my practices and hospitals in the exactly opposite direction, which helped me save nearly 1 to 2 hours of traveling every day. Apart from this, it is important that we get organized by using some calendars in our life. A personal calendar which chalks out all the events or all the major family gatherings or other events which are upcoming, which is a personal thing, while a calendar which is attached to the clinic, gate lab, and my personal secretary, which maintains a record of the operative as well as the clinic records, helps to keep a lot of stress at bay and helps to maintain the organization very easily. And what helped more, apart from getting organized, was having a very good team to work with. I've been lucky to have that in the past 2 consecutive years, there has been a female fellow with me for a year for a structured fellowship program. and she is one of the second female fellow with us this year. Apart from this, there have been junior attending and colleagues who have helping me in my day-to-day practice and procedures where I need additional help. And at the Gate Lab, I have an assistant, additional biomechanist who helps to maintain the records and keep data of all the patients which we are working with. So all of these together teamwork has helped to keep a very good data and help me to manage my practice very easily. And it is important that if you want to go far in life, it's not important to work alone, but it's good to have a team of people who work with you and who help you around. Not only this, it is important to have a mentor in life, because private practice is just not easy. There are times when there could be hurdles. There are times when I needed help, support, and I'm fortunate to have very good mentors in my life in the past 10 years who have helped me grow in my practice along these years. And with all these things, it was very easy to have a very good professional and a steady professional growth with good attachment in the academics, in spite of being in private practice. Many people, they told me that once you leave a institute, it's difficult to remain in the academics. But yes, with all the things which I have mentioned before, it is possible, although it might need some extra effort. And with this, how to maintain a good or how to ace in the practice, one of the other thing is self-branding or self-promotion or advertisement. Each of the country has their own limitations, and considering the Medical Council of India, whatever self-branding or advertisement is allowed, that we can perform through the websites, the TV channels, the YouTube channels, or other social media channels. And that's what I promote, and I also encourage others to do that. And last but not the least, in all of this, when we put all this effort, it is important that as a woman who are not very much focused on their investments, we should be very much thinking about our financial freedom and how to utilize whatever money we have made to multiply for us and use that money whenever we need to take career breaks and also as a support system for retirement. We might not be as active as men as we grow older, and that's what many females have told me. And that's how I think this is one of the most important things which women should look at. And while we are looking at all of this, it is a task and it takes a toll on us. So, but it is important that we prioritize ourselves, because we know that 54% of doctors, although they just mention that they have gone through burnout, while there are many others who suffer much more, and there would be doctors who would not recommend a career in medicine to their children or near ones. So that's how a burnout affects us. And maintaining this or doing a private practice or running around places or juggling hospitals is tough. And this should be kept in mind. And with this, I would suggest that we take the second thing in mind, that how to maintain a good health and how to remain fit. So coming to the second part of the talk, that how to remain fit, it is important that we have a very healthy diet, things that make us happy or things that make us alive. And of course, do things which is going to keep us fit and healthy. I recommend that we at least have 2 to 3 days of workout, any sort of exercise, and it should be done no matter what. However busy our schedule is, that time should not be missed. And that is supposed to be our own time, and that should be done. Of course, whatever looks nice and rosy in all these slides before, there have been times where I have gone through not only just highs in life, but there are times when we are low. We need support. We need to introspect. We need to look inside. We need to look for help. And that is the time when we should think of mindfulness and meditation. Not every day, but there should be some days in a month when we would look at these things so that we remain grounded and so that we are connected to ourselves. And this is a very important thing to keep stress at bay and do good work as we go along. And what things keep us alive is soaring to new heights, not only in our career, but also in the hobbies or activities we do. Apart from all these things, I am into much more of adventurous sports. And one of it is trekking. The highest I have trekked is the Everest Base Camp at 17,000 feet, followed by 10,000 feet at Bhutan, and then nearby treks in our own country, which I have done apart from Nepal and Bhutan. What thrills me more is my love for cars. And that didn't end just by driving in the traffic in Mumbai, but I also drive on some of the speedways and the motor circuits in India. And I'm part of the Formula 4 racing team. Of course, the COVID has taken this into, the car is now in garage, but hoping back to get into this seat soon. And yes, day-to-day activities which would keep the happiness hormone on a high rush. And this activities is what they keep us happy. And what makes us wiser is traveling. And in the past 10 years, apart from leisure travel, I have traveled to nearly around 10 to 12 countries for attending various conferences, courses, increasing my knowledge and improving the skills. And that's how I think, of course, it makes us wiser and helps us to know the different practices across the world. We are privileged to be in this position as doctors because we get an additional benefit to help people, to make a difference in their lives. And it is important to leave our mark of footprints as we move along. And in all this time, I had a very special place for kids with cerebral palsy in my heart. And over a few years in my practice, I set up an NGO called Footprints, which works at empowering individuals with cerebral palsy. We try to create awareness about cerebral palsy, which is very commonly known as polio still, in spite of all this education. And over the years, I have conducted various marathons and events to create awareness about this particular thing. And we have helped many individuals, not only as a financial support for surgeries, but also for their splints and orthosis, because these people do not have an insurance coverage. And I have done my part of it to make a difference in the life of these kids. So to conclude, I would say that yes, not only as women, but even men have similar responsibilities and things to do. And what we should focus it as looking at our work, of course, not all the time to compete, but to get the job satisfaction and the happiness we want and grow each day, not to compare ourselves with others, but just look at the day which is gone behind and make the next day much more better. Yes, to put ourselves first in all ways. And it's okay to say a no sometimes. It's not possible to be present everywhere and to do everything all the time. So it's okay if once in a while we say a no and maybe or may not be given explanation for it. And yes, we leave our footprints as we live our life on this earth. And it should be by imparting the knowledge, treating people, and helping those as we are privileged to do so. So thank you so much.